this all the time, some unfamiliar faces. So my name is David Khaoya. I lead an organization that handles some aspects of one of the building blocks of the WHO, which we call healthcare financing. So we support healthcare financing at both national level, and we also have some work we do at the county level. So my organization will consider an NGO or INGO. We are funded by the USAID, and we basically support government. We don't come with our own activities. We support activities of government. So I think that's important to know, because sometimes donors are accused to come with their agenda. If they find you in the office of the government somewhere, tell them that as government you have your own agenda, and therefore they fit into the agenda of government, not coming with their own agenda. Yeah. So I was asked to give basically some experience in the course of doing our work. And so because it's an experience, one thing I've noted over time is that sometimes experience is not in alignment with the theory. You may learn theory, and theory says things are supposed to be done in one way or another. But the experience out there is different. Like, we know that there are certain theories which are very clear, like the demand theory, the supply theory, and so on, consumer theory. But when you go on the ground, you find things are happening in the opposite of what the theory says. So what I'm here to do is to share what that opposite is all about, so that you can now see how you can position yourselves to apply the theories that you have learned, including the theories you are learning around HTA. So basically, I'm supposed to focus on national health policies and strategies. And before I start my discussion, I just want us to have some concurrence on the objective of this session. So I'll be basically giving an overview of national health policies and importance in healthcare decision making. And here, basically, I'll be trying to give you the snapshot of how we organize our policies as a government or as a country, how policies are organized, where do you get these policies, and so on. And two, we will be looking at the definition and significance of HTA within the context of national health policies. I know now you are experts in HTA, so I'll also want to learn from you what this HTA is and how you can therefore apply it to the formation and the implementation of these policies. Then I'll also be talking briefly on integration of HTA in national health policies. My experience, of course, like I said, because I'm not very good in theories. I'm only good in reporting what I have observed over time. And of course, we will end up with the examples highlighting successful integration of HTA into national health policies, if those examples are available. And because you have now been taught what HTA is all about, I'll be learning from you what these examples are all about. So this is basically what we intend to cover. But like I've said, theory can say we will cover this, but the experience dictates that we only cover two. It doesn't mean that we are wrong. Maybe we run out of time, or we have no material to discuss on either of them. But that's basically what we have set out to do. So like I've said, let's start with just trying to understand. And this will basically be interactive, although it's indicated that it's a lecture. I used to lecture at some point. I'm trying to retire slowly so that I don't keep lecturing. Because lecturing is good, but sometimes it's one way. We want it to be both ways. So before I came here, sometimes back, I was asking myself, so if anybody wants a certain policy, which is the office that you walk to get a policy document, or to even get information about a policy? Or which offices do you go to? Like I've said, this is interactive, so let me know which offices do you go to if you want a policy on maybe alcohol or tobacco control. Which office do you walk to? NACADA. Why NACADA?
Because it's the body that oversees and fights various aspects of alcohol consumption and tobacco control.
Okay. So that is clear because it's a body that we are. The PHC policy?
Can you get them online? You don't even have to go physically, but you can get them online.
You can get them online.
But they're all health policies.
All health policies.
Yeah.
So ideally, we have some idea of where we will get these policies. We may know some offices where we can walk to, but also we know that we can go online and try to find. And so for me, I decided to go online. And I found there are innumerable number of policies. Innumerable means I could not even count. There were so many. So now the question I was asking myself, if I want to know the latest policy on alcohol, or latest policy on anything, how do I get that information? Because the way they are there on the website is like a store where the policies are kept.
But they have years.
Some have years. These are actually, I've extracted some here. So there are some with years, but if you get like a checklist for assessing quality of healthcare, Kenya Quality Model for Health Level 2 facilities, March 2018. There's no information to tell you that there is another one which is 2019 or 2021 and so on. There are some that are 2013. You may not have any information as to whether there is any updated version. So one can easily spend a lot of time, like recently I saw the Senate was discussing the PFM Act, and towards the tail end, they realized that they were discussing the original act, but there were so many revisions. So they were accusing the controller of, the Auditor General of having not adhered to the law. But nobody noticed that actually they were referring to the original one, and there were so many updates. So and you see the way we do our acts, we only write the update. Then we say refer to Article 215, delete and replace it with this. But you see, when you get the original act, it doesn't tell you that there is another revision or update that has been made. So if you are looking at one, you now need some very innovative way of trying to find out where are these other updates and where are they. So when I went online, I found this innumerable number of policies, protocol for implementing community-led total sanitation. Some are not even clear whether they are policies or not. And so the question now which you ask yourself is, what is a policy? In your own understanding, what is a policy? Because if I look at these names, I can pick some that I can clearly say this is a policy because there is a word policy somewhere. There are others, they say guidelines. Are guidelines policies? Because unless we understand what it is we want to talk about, it will become difficult to apply the knowledge you have covered for the entire week on these policies. So one is just written essential package of health. So you are not so sure whether it's a policy or what it is. So ideally, I have not put this here so that you try to understand what each one of them is saying, because this is just a sample I picked. Like I said, there were more than 400 and something when I counted. I counted 412 or something like that, and the list was still growing. Some, they put years, so you can easily say this is maybe an update of a previous one. Some, they even change the name. They can say tobacco control policy, or they can even call it tobacco control and guidelines policy or something like that. So it means that even the way in which the policies are arranged is a challenge, and it also means that we need to start understanding what are these policies that we are talking about when we talk about policy. Because we've seen that even gazette notices, some gazette notices are also there. So it makes it very difficult to understand what a policy is. But from our own understanding, or from my understanding, The policy is just a statement of intent by the government. The government intends to achieve something, and so they put it down on paper. So a statement of intent. But now the challenge is that if you read theory, it tells you that policy precedes strategies. You come up with a policy, then come up with the strategies to implement the policy and so on. But in practice, like I said, there are times when we start with strategies before we develop the policy. Is that the case?
Yes.
Yes. There's nothing wrong with that because sometimes the things dictate that you start with the strategies because that's what is required at that point. The other day, I was seeing the government preparing the UHC policies or policy. But we are already in the process of trying to implement, meaning that we are coming up with a policy after the strategy has already been rolled out and things like that. So that's why I said that theory says one thing, but practice says something different. And so if you have knowledge which you have gained here and you want to apply on a policy so that that policy informs strategy, you will realize that as you are informing policy, the strategy is being rolled out. So is there anything wrong by rolling out a strategy before the policy?
The policy should guide the strategy. So the policy should always essentially go fast before
Yes.
the strategy.
Yeah, but I've just told you that in practice, some policies are coming after strategies have been rolled out. And here we are talking about how HTA is supposed to inform policy making. You get where I'm getting to. Yeah. We want this knowledge we are covering. Yes, yes, please.
Yeah, I was thinking,
Yeah.
the problem here is
Yes.
you come up with a strategy without a legal or you come up with a strategy that has no legal framework or binding, and then you start complaining it's, there's no adherence to it, there's no enforcement,
Yes.
but yeah, it's just, it
Yeah.
becomes difficult.
So the reason I'm trying to emphasize this is that theory tells us one thing, but when you go on in the practice, you will find that things are happening in the opposite of what theory is saying. So what that means is that we have to be innovative. We have actually been taught what HTA is all about. And we are being told how HTA is supposed to affect policy making. But then as you are doing that work, you realize that the policy that you are trying to inform is already being rolled out through a strategy. So the question you are asking yourself is that how then does your knowledge affect policy if the policy is coming after the strategies have already been rolled out? I said I have no answer to some of these questions because they are also puzzle me because you ask yourself then how was the strategy crafted if there was no policy guiding and so on.
There's a question.
Yes.
It's not really a question, but I'm trying to relate with what you have said,
Yes.
especially when you said there's no really answer. Like in the health sector, we have the Kenya Health Policy.
Yes.
And for a very long time, I can say since Alma-Ata Declaration, we have always been trying to go and work around primary healthcare issues.
Yeah.
But then our Kenya Health Sector Strategic Plan only has a mention on primary healthcare. But come 2010, we went into devolution, right? So primary health is under jurisdiction of the counties. But you realize the way County X is executing their PHC is different from County Y, and trickle-down effect to community health, such that if you want to know the status of the entire country at the primary healthcare space, it becomes challenging because counties are coming with their Community Health Act, and they're different, they're not talking to each other. But then we expected at the national to have a one status approach for the entire country that you can mirror, and you can also do best practice that worked in County X and can be implemented in County Y if they have similar characteristics. So you realize we've always had a strategic plan, but you are doing a strategic plan for primary healthcare without a primary without a primary healthcare policy, but we were basing it on the larger health sector policy. So later we realized that now we have a strategic plan, but there are things in the strategic plan we cannot operationalize, we cannot execute because counties have different dynamics. So we had to learn that lesson, and then we had to now develop a primary healthcare policy. Then after that, we now review the primary healthcare strategic plan. Then we realized it is working. After some time, we saw that now to institutionalize this across board, let's come up with the laws. So it was a learning curve, but the health sector policy was the benchmark for all other strategic plans.
Yeah, thank you very much for clarifying that, because that's exactly what I said, that circumstances sometimes dictate that we start from one point and move on, because our policy process is also a long process. I know one of the policies took almost 17 years to come up with, because of the issues around the stakeholders and ensuring everybody is on board. And currently, you know, the public participation thing. You can actually have a very nice policy, but then as it moves to the next stage, somebody challenges it in court and says there was no public participation and so on. So it's quite a long process. So what happens when you are supposed to implement and it's taking that time? That's why we use those shortcuts. Let me call them shortcuts, but they are actually also long cuts, because it's also not easy to implement a strategy because of the issues of the stakeholders who must be involved and so on. So you are right, whatever you are saying, like I mentioned, there's no right or wrong, because both of them have been observed. We've observed situations where we have policies, then strategies follow. We have also observed situations where we have strategies come before a policy and so on. So the bottom line is that now with the knowledge that you have, if you go to the field and you find the government is working on a strategy, but when you ask, is there a policy that is guiding this, you are told it's not there. How does your knowledge that you have gained inform that type of strategy? That is where I'm driving at. You need to ask yourself how that knowledge is supposed to inform the rollout or the design or development of that strategy. So I'm putting here some information to show you, because I showed you different types of policies as I went online. I tried to capture them. Some were very clear with the name policy in the title. Others did not have any policy anywhere. But like I mentioned, from the way we know what a policy is basically a statement of intent. There are many ways in which you look at it, but once you summarize in that manner, it should be able to guide you on what it is that you want to do. So this brings me now to how policies are made. Because unless you know how they are made, you will not be able to come and support them with the type of knowledge that you have covered, to try and show them the effectiveness of some of these policies. So if you are in charge of policy-making process and you find a process that takes this type of a structure, it will be very difficult even to understand where you need to intervene. Because in here, we have very clear flow of how a process is made. But look at the interests. The interests coming from cabinet, parliament, from ministries, from private sector, from CSOs, donors. That's why I said, if you are in government and you are implementing a policy, stick to government policy. Because if you sway by the fact that a donor has spoken to you, or a civil society organization has spoken to you, you will find yourself on a wrong trajectory, any one of them. And that's why sometimes we find it very difficult to come up with policies because of this interest. So what it means is that there are some people with more power than others. So if they are influencing policy, the policy tends to lean towards where they are coming from. So in this case, who will be having more power than others in terms of these people on the side? Private sector.
Very strong nowadays.
Private sector, very strong. Even donors. Yeah. So basically, and some of them could be strong in just one aspect. So that when the policy reaches there, you find it's pulled on one side and not following the process that it's supposed to feel. So in this type of scenario, where would you apply the knowledge that you have covered this week? At what point? I'm not saying the knowledge is not important, but you need to know how to target it so that you can target these stakeholders so that as they come to try and influence policy, you tell them, but this is what data says, that the effectiveness of this policy will be this, so that they don't just weigh you on one side. And they're also very clever. They also invest in people like yourselves to come up with counter data. So it means that you must be able to have your own data to rely on. And when they come with counter data, you ask them, where is the source? I work for an NGO, so I know what happens out there. Data can be showing a very straight direction. But when people are discussing, they are pulling things in the opposite direction. But as you know, data does not lie, isn't it? It's the people who lie with data. So it means that if you insist on them demonstrating what they are saying, then you will end up on the same trajectory. And that's why I'm happy that you guys are covering this course, because then you will be able to argue out and say, look, but the effect of this will be this. Let them convince you otherwise. I hope there are no donors here, otherwise I'll be in trouble. there could be a donor here. Yeah. So basically what I'm saying is that having the knowledge you guys are having now will be very key in trying to ensure that the policies go the routes that they are supposed to go based on the knowledge and evidence that you have been able to analyze or you are able to gather. Because different groups here will come up with different interests. Recently, I was doing an analysis of the budget, and some group came there and then said, this budget is not gender sensitive. Like your budgets in the houses, are they gender sensitive? Or how will you demonstrate using your own household budget that your budget is gender sensitive? Anybody? Yeah, because when they argue that way, it means they are forcing you to do something.
You buy blue clothes for boys and pink
There is, yeah, you need to answer it with, in the microphone.
No, I'm just joking.
Yeah.
You buy blue clothes for boys and pink for girls. Anyway, it's
So-
neither here nor there. I'm just joking.
Yes, there's another suggestion there. How do you make sure your household budgets are gender sensitive?
You shouldn't focus, okay, let's say you have, I'm looking at it from the context of male-female, yeah? So you can have a household budget where the males are more considered, especially when it comes to personal items. You see, like for ladies, we need more extra, beauty items. We want to have our hair done. We want to have, new shoes, maybe frequently more than the men. So if this is not factored in the budget, it's really not gender sensitive, according to the needs.
So it should be like 70% to females and then 30% going to males.
Maybe, but not really. Yeah, each household can decide, but at least there needs to be a percentage that ladies are actually given by their husbands to take care of themselves.
Yeah. Yes.
Yes. Let's hear from him.
Yes.
Let's
you
hear
can
how
look
he
at,
balances his.
Yes, you can look at what has been bought by the budget,
Yes.
but also you can look at the people preparing the budget. So there could be an assumption that if you're man and wife in the house, or boys and girls, then you have involvement of both gender in the budget making process. Okay. So whatever the outcome, because there are things that we'll use together regardless of the gender, so because there is involvement of both of them, then the assumption is that it will be balanced.
Okay. So for him, once he incorporates the views of everybody, then he is able to demonstrate that his budget is gender sensitive. So it doesn't matter what proportion they are, the issue is about the process. Okay? Yes, you have, how do you balance yours, sir?
I think the main issue is not the value
Yeah.
of the budget allocated to each gender, but have you met the needs of each gender? And it doesn't matter where it comes from, because if you have a kit here of 100,000 and you have 3 ladies in the house and 1 man, then the budget can't be the same. You can't put it on the gender issue, because the man will require a very little budget. But are you able to meet the costs or the needs of each and every member of the family?
So for you,
the percentage doesn't arise.
So you, once you meet the needs of all of them, the percentages should not be an issue.
The percentage should not come in, because the percentage you give 50-50, where you say is equal, but there is only 1 gentleman in the house.
Yes.
Again, it's 5 ladies.
So, okay,
So it can't be.
Which is a very good argument. So if somebody accused you today that our country's budget is not gender sensitive, what will be your sort of response to such accusation?
Yeah, when you look at the national budget and you look at the needs of the ladies, yeah,
Vis-a-vis the needs of
the needs of men,
yes.
are we able to meet their needs? When you talk like my colleague there talked about the beauty part of it, you know, the beauty products.
Yes.
They need them for that.
Okay.
So are we budgeting them for that? Like something like even as simple as sanitary towels.
Yes.
Are we looking at how to allocate money for that?
Okay.
You can't say that because you have allocated sanitary pads for ladies, what will you allocate on the other side for men?
Yeah. So the point I'm trying to demonstrate is that different interest groups will come with different interests, and they will be pushing you to move towards their interests. So the gender activists will come and say this budget is not gender sensitive and there are certain things they require in that gender. There are other groups that will come and say private sector is not factored in this budget. And they will come, like she has said, they are becoming organized and very powerful. They'll come and sway your budget into one direction or another. So basically what we are saying is that when they come, sometimes they come with some data. They want to show you some data. So you are also arming yourself to be able to tell them, look, but we have done an assessment and we have seen that if we invest here, this is how the outcomes will be, and so on. So don't take it on the face value. And that's why it's important that you are able to equip yourselves with the knowledge that you are getting in this course, so that you are able to give counter proposals when somebody comes and says, this is where we want the money to go. Some people will come and they don't want to hear about any reason you give. They just want you to put 20% somewhere. Meanwhile, the other side, they don't even care whether there's anything going there or not. So what that means is that in the policy-making process, we normally look at something we call a window of opportunity. A window of opportunity. So there is opportunity for policymakers. But then there is also opportunity for us to inform them about the information that can help them make the right decisions. So if people are pulling the policies or the budgets or the whatever decisions into some direction, and you have information that you can provide, you wait for that opportune moment and try to tell them, look, although you have put more money here, had we put this money here, this is what we are likely to achieve. Although you are thinking of coming up with this new technology, if you do an analysis, this other technology is better in comparison with this other one. And how can you make that without the knowledge you are covering today? You are now being equipped to be able to compare technologies. 2 products have come in the market. Every stakeholder is pulling on their side. Some are having cocktail dinners for you so that you can now be softer on making decisions towards what they want. But from your own analysis, you see that the other one, which has not had a cocktail for you, is actually the one that is going to be much more effective. But without the knowledge you are getting, you wouldn't know. The one who is pulling from their side will actually convince you that their technology is more superior than others. And sometimes new technology does not mean it's superior. Sometimes the old technology might actually be better. But you need to do an assessment to be able to provide that information so that you're armed anytime they come. You are saying, look, the problem we have is this. The policy that you are coming up with is not going to solve our problem because of these facts. So on. Of course, these are also opportunities. Political will are opportunities for us to be able to influence policies. So, meaning that when the opportunity comes, let's present the information. And when we present that information with these opportune moments, we end up achieving what we want. So you can't, because sometimes we support the budgeting process. And some people come on the negotiation tables with a lot of emotions. But Treasury doesn't consider emotions in allocating resources. Oh, you know, this cancer disease, you know, is very painful. That one is not relevant for policymakers. Yeah. The pain is not a yardstick to allocate resources. Yeah. That's why you find the education sector gets a lot of money, because for them they come with data. They say we have this number of pupils in primary school, and each pupil requires so much to be able to clear 1 year. So they just take the number of pupils times the amount. They already know how much to give them. People in health, which information do you come with? Oh, you know, malaria, is a very endemic disease in this region. So endemicity is not a yardstick to allocate resources. You must come with data to support your claim. Otherwise, people will share money while you are there, because you didn't have any data to support your request. So for those of you who are in the ministry and you want to participate in the MTEF process, don't go there with emotions, go there with data. Tell them the return to investment for putting money in malaria vis-a-vis putting money in these other strategies will be this per year or something like that. Then they will listen. Not emotions. Some even cry. Even when you cry, there's nothing we can do. Tears cannot add any percentage on your allocation. Yeah. So, I know you have covered HTA, so it's actually an opportune moment for you to tell me. I've told you what is happening out there. So now with the knowledge you have covered, I need just 1 or 2 to see the knowledge you have covered around HTA and the mess that we see around policymaking processes and strategies. How can that knowledge be applied? Yeah, 1 or 2. Or the course started today. I'm aware that it started on Monday, isn't it? Just 1. If 2 is too much to ask. Or maybe you can define it, then I can help you to see how to relate. Like I said, I'm not an expert in HTA. Dr. Tabitha is here, who is an expert. But she has already told you what HTA is. I've told you what the environment looks like. I've also told you the opportune moments when you can be able to inform policy-making processes, so that when people accuse you of something, you are able to provide data and evidence to show the opposite. So if somebody came with new technology, and when we talk about technology here, we are not just talking about technology the way we know it. We could be talking about change of policy as a technology. We are now changing how we offer services through PCNs, for example. Has anybody done an assessment to show how the PCN type of delivery will be different from the service delivery model that we have been using in the past. Or everybody's just rallying, we call it bandwagon effect. We're just rallying on something that nobody has done an assessment. I was just giving that as an example, so that you don't look at technology to be that technology that is coming from the West. We have now come up with an essential benefits package. It's not like it's new. We've been having a package, only that we didn't publicize it the way we have publicized this one. But we have reorganized it in one way or another. Is that reorganization going to be better than the organization that we've been having before? So once we start asking ourselves those type of questions, then the knowledge that you are covering here becomes very useful. So don't shy off telling those people who are telling you to do something different that you have information that you can provide to make them make the right decisions. People come with the new drugs. I know pharmaceuticals is where we normally talk about new technology. People come with the new drugs. But the way they convince you, have you done your own assessment to see whether the new drug, because some come and when you ask them about the literature, about the effectiveness of or efficacy of that type of commodity, they start becoming dodgy, especially when they are generics. They say, no, you know, that was done by the originator. So they need to also arm themselves with the literature from the originator so that we can now be able to compare. I see a lot of people running around in the name of sales reps or medical reps. I don't know the difference. They can convince you to buy something you didn't want to buy. Yeah. They can make you think that when you take whatever they are selling, that will be a game changer. So what it means is that we need now to be able to use this knowledge, which is multidisciplinary, so that we are able to convince anybody that this new technology is better. And I've said technology is not just about the technology the way we know it. It can be just a change of approach with the current establishment. Like I've given you 2 examples where we are. The government is trying to to change the architecture of how they provide healthcare. So we need to be able to apply the knowledge that we are covering here to see whether the new approach that they are thinking about will be better than the previous approach. And when you start thinking about that, then you start asking yourself, so what are these factors to consider in terms of like, what is the outcome that you are looking at? It could be that we will do the PCNs and at the end of the day, the health outcomes are not improving. Will that be a reason for us to discard the PCNs? So on. So the purpose of the HTA that you are covering is basically to inform decision making to promote an efficient, equitable, and high quality of healthcare. So it means that the knowledge you are covering should be able to assist you make the right decisions about the type of approach that you are applying. So as I come closer to the end of my talk, because remember I'm not teaching, mine was to share experience, and the experience can go either way. There's no right or wrong experience, because you wouldn't know, your experience could be different from mine. So the processes of policy development and implementation in the public sector is complex, as we saw. Very complex in the sense that sometimes even the policymakers themselves don't realize that they are making policies. We have been involved in processes, including colleagues I'm seeing here, where we have been sent out to come up with some information to inform a policy decision. But while you are in the field, you watch TV and then you see a decision has already been made. Yeah. You are sent for 2 weeks to come up with an essential benefits package, for example. I'm using that as an example. While you are in the field, it's being announced that they are unveiling an essential benefits package. Until you ask yourself, did we get the instructions right or what? Maybe we were supposed to come and review an existing one. So that's what I'm saying, that sometimes you end up participating in a process that you are actually even don't know that you are participating. That's why when you go for some meetings, you are asked to sign so many papers and you don't even know why you are signing. so that anybody who protests, they say, no, but they all signed and they participated. Now, like, we are now entering an era of public participation. Anybody who is even passing in the neighborhood come and sign. So that when we go to court and rumble the accusers for lack of public participation, we can show registers of people who participated. So those are things that we see out there. So the question we ask ourselves, are these decisions informed by the type of evidence that we gather? And I've just told you that it's not possible that they will be informed at all the time. But as experts, you can observe the windows of opportunity when those windows come. If you work in the ministry, one day the PS calls you in her office or his office, then you can take an opportunity to say, by the way, now that I'm here, this is exactly what we are likely to face if we do this. Then you go. He'll be thinking, what did she say? Yeah. Those are opportunities, because maybe when you go formally, you are not even allowed. But now you have been called, you are in the office. You can actually be able to offer that type of info. And you can only offer it if you have done a course like this. So take this course very seriously, because HTA, as you know, is a new, let me call it a new concept in this part of the world. But elsewhere, it's a concept that has been there for many years. So it means that when we build a critical mass and everybody talks about it the way we are, then people will start listening to us. Otherwise, if it's only one person, they say, what is she saying? What is HTA? And so on and so forth. So I will not take so much time after this, because the issues about the role of HTA in informing healthcare policy decisions, we now want to see what are these steps or the stages corresponding to when resource allocation decisions need to be made. Because those become opportune times when you can now inform them about the knowledge you have. Identification and prioritization, adoption, implementation, and research, further research. These are the stages in the policy-making process when resources or resource allocation decisions are made. And remember, we want to use the knowledge we have to inform resource allocation. So it means we have to come in at the right time. So at every stage, what information do you want to offer? The evidence around horizon scanning methods, assess implication of any HTA studies undertaken. So if you are looking at a new product, for example, ask yourself, whoever is coming to convince you what studies have been done, let them share. You will find that there are some who have done very good studies to support the type of technology they are, and so on. So it means that at every stage, we need to ask ourselves, what information do we need to offer to be able to support the type of decisions that are there? So what I'll be sharing, I think the organizers will share these slides with you so that you are able, in case you have any additional questions and I'm not there, please feel free to shoot an email so that we can continue the conversation. Otherwise, basically what we are saying is that this information that you are covering, or the knowledge that you are gathering from here, is very important, and it's important at all the stages in resource sharing decisions. It's not just like, oh, some people always say, I gave them. You gave them in January, but they are now discussing in June. Give them again that information. So don't shy away and then say, because I gave them, I will not give them again. Give them until they say, this one we have. Let them demonstrate how they have utilized. So this was just to demonstrate the type of information that you require, or the type of evidence you require at the different stages in the resource sharing, in the policy implementation. And finally, we want to quickly look at, in just 2 bullets, strategies for integrating HTA into the policy-making process. We have seen the confusion that is there in the policy-making process. So it means that we need to have a way of coming up with a strategy. Otherwise, you will be lost in that confusion. you will be one of the stakeholders. And then, because you are one of the stakeholders, some people will be coming to get your concurrence so that they tell others that, you see, we have so and so supporting us on this. So it means that there must be a very clear strategy of how you are able to institutionalize the health technology assessment type of knowledge. One of them is the independent institution undertaking HTA on behalf of MOH. These are my suggestions. You could be having your own. So if in some countries what they do is that to have a very independent, so if you go there with new technology, is referred to that institution to be able to do an assessment. Then have a very formal way of informing the government so that they make decisions based on that information. Another way is to mandate HTA in the policy processes, meaning that as part of the things that are normally checked before a policy is adopted, you check, was HTA done? And this can be through legislation or any other way, like the way government does this presidential decree, there is legislation, there is, and so on. So to mandate so that anybody who approves it, that becomes one of the criteria. Was HTA done? You could be having other suggestions. I've just given you two, the ones I was thinking about. Because at the end of the day, we may talk about HTA and nobody sees it implemented anywhere. Because we have not found a way of institutionalizing it. But if we have a body that is mandated to do that work, we can actually pretend to be pointing fingers at that body and say, you are not doing this. The way we point fingers at anti-corruption bodies and say, we say, you are not doing this. But then after we point, we go and get corrupt. Yeah. At least we have somebody to blame, isn't it? Yeah. Yes. Because at the moment, we have nobody to blame for HTA, isn't it? Whom do we blame if HTA is not done? But there's no requirement that they must do it. So why should we blame them? There is no guideline. Yes. So we must create a body that we can be pointing fingers at and say, you did not do HTA here before this technology was implemented. Otherwise, thank you very much. That's where I want to end my talk. Any questions, if you have any? Yes.
I'm just seeking a clarification.
Yes.
On the HTA informing policy or doing a HTA first, then developing the policy. Then the third one, what's the basic or the bare minimum? I know it's dependent on what you want to achieve. Cost of doing the HTA and cost of developing the policy.
It's a good one. So what we are basically asking is whether there is cost effectiveness in doing HTA in the first place. Isn't it? So what that means is that then you need to understand what HTA is and what benefits you get out of it. And what happens if we don't do it? What are the losses? What are the losses that we are likely to incur if we don't do it? So the idea is that HTA should inform policy. Because remember, policy, we say it is a statement of intent. You want to do something. But what is informing you to decide that you should do that? HTA comes in handy. You need to have knowledge about the assessment so that you can do it. Because remember, if we use the example of a new drug which has come in, and we are asking, or a new way of doing maybe a surgery that has come in, and we want to either make a decision whether to adopt or not to adopt. If the policy is to adopt, what will you have based on? That's why HTA should come first, not the other way around. But I'm happy to learn if there are cases when the policy should come first. Anybody who has an example, because you know this world is, there's nobody with monopoly of knowledge. There could be situations where policy comes first, then HTA comes second. But in my own assessment, that policy decision should be based on information from the HTA. I don't know whether I've answered your question. Thank you. Any other? I'm allowing like 5 minutes so that I don't take a lot of your time. I see it. Time. Yes, there's a question here. Yes.
When you look at HTA, there's a lot of research behind it. And we have been informing our institutions to invest in research. And I also see HTA linking between research and policy. Would you maybe comment on that?
Thank you. In fact, that was my basis of making recommendations as to where HTA should be institutionalized. Because of that type of the heavy investment in research and the type of information that you require. You may want to do HTA, but you don't have the requisite information to be able to make that decision. And so if we get an institution that, and some of them are in existence, by the way. We have institutions in this country that have been put together to basically inform policy-making processes. The Kenya Institute for Policy and for Public Policy and Research Institute, KIPRA. That is actually their mandate. But their mandate is in public policy that does things to do with the macroeconomics and economic development and so on. Do we have a similar institute, for example, to offer that type of service to the health sector without necessarily going into the details of macro and development issues, just to be able to analyze these drugs, new technologies that come, new type of approaches that come? If we had something similar to KIPRA for health sector, then we will have achieved what we want, because then decisions will be informed by information that is coming from that type of assessment. So you are very right to say that they are heavy in research, and that's why my decision was to recommend a body or to mandate, because if you mandate and make sure that government officials, before they make that final decision, they are able to seek support to be able to do an assessment, then there will be people, consultants, institutions like the universities and so on, who can actually offer that type of work. Because after all, they are public institutions. When you go to universities like in South Africa, most of them, they actually have an MOU with the government, so that these surveys that are normally done by the KNBS and so on, they are done by a university as part of learning. So they are funded just the same way KNBS will be funded to do a survey, and they do an assessment. So they have, like within the university, they have a body that actually handles data. And if you go there, they have actually more data on Kenya than Kenya itself. I studied there and I realized I spent almost 6 months here looking for data. So when I went complaining to the person in charge of data there, the type of data I'm looking for, then he said, but we have this data here. So I was like, how? It's so easy to get it while in South Africa than at home. They have almost data across the entire Africa that when you go here, you can't get it. Or if you have to get it, you will write so many letters, and some will be lost before they are approved. Yeah. Yes, sir.
So mine is just a comment also,
Yeah.
from the discussion there.
Yeah.
And I agree. So I'm trying to think of, that moving forward in the Kenyan context,
Yeah.
probably African context.
Yes.
You're right that we need to, one, resources are becoming more scarce.
Exactly.
We are in financial distress, debt distress. Kenya is in debt distress. We are seeing some elements of an economic, I don't know the wording, let me say, a downturn or a slowing down. So resources are becoming even more and more scarce. But on the flip side, we are also trying to in the journey to UHC to provide, better and better services for the population. And therefore, the question of how we, make decisions on policy and how we resource allocate vertically and horizontally, the questions of effectiveness, equity, are quite major. And therefore, as you put it, I think moving forward, there has to be like a dual process where, one, of course, we have to do what we need to do. Decisions will continue being made, but they should include some element of a quick, short assessment, assessment of some kind that supports the decision.
Yeah.
But then, because that has to continue. So I think we need to improve our policy process slightly. Even if you're in a hurry to make a decision, taking a day or two to allow for some quick assessment to facilitate the decision making, I think is critical. But I'm on the flip side, I'm also seeing that on a more regular or more, as you said, more medium long-term scenario, there seems to be quite a lot of data collection that needs to happen, so that we start also having in-house, or regional data. And in fact, you made me think, and of course, data collection research is expensive, time-consuming effort. So one, I think we need that framework completed so that, like you said, I like that example, and I think that was, Dr. Nancy, that was the initial proposal in the framework. So, some working arrangement between the universities and, centers of excellence like CIMA,
exactly,
and the Ministry of Health, which would have like a secretariat,
exactly,
so that data is being generated, across by the various universities and centers, and then you're interacting with that data and seeing how best do you, and KEMRI, etc., how best do you apply. But you made me also think that, because during the week, one of the things that has come out is, of course, there are countries that are way ahead, already have quite a lot of this figured out. But due to the excess limitation of resources in our environment, it begs the question of maybe we also need to start thinking of regional collaborations. When it comes, so that because African countries, we have a lot of similarities. If Uganda does a HTA on, particular research question, you might not really have to repeat the entire.
Exactly, yeah.
As long as you agree on the process, and there's a guideline of how that process is done, so that the results are, reliable across board. Maybe also some regional collaborations with other centers for HTA could be very helpful, and therefore, of course, some kind of databases across the African region would be quite fantastic in sharing results, lessons, and that kind of thing. But my interpretation, like you said, we are now moving to social health, universal health coverage. We're trying to include everyone. That's always a challenge. Resources are few. So increasingly, the question of where do I put the money, I think is going to be a very increasingly complex question that requires, so I see the future is bright with HTA in my view. Based on where we are going, the future is quite bright in terms of how do we use this to answer some of the questions that I think we are facing. And even in the package, I think the package development process, and I know that has really brought out
the need for
HTA, because a lot of the decisions have prior not been supported by a lot of evidence from the assessment process. It's been a bit, sometimes even arbitrary or purely on a budget basis. I don't have that money, so I'm not doing that, let's do this. But so I think, as you put it, that, okay, fine, we say policy making processes are not linear. It is muddling. Because of the other political processes. But I think nonetheless, from a technical level, if we can have a slightly more, acceptable way of doing it, but supported by evidence.
Exactly.
I think that would be great. So mine
Yeah.
is just a comment that
Thank
I agree
you.
with you.
And-
We need to
yeah.
review this policy process
Yeah.
and see how do we embed this.
And I like the fact you say that data collection is expensive. Yesterday I was in a meeting where we were trying to and understand like the systems we have, what type of data can they generate? Because sometimes we go collect data that can easily be collected with the gadgets that we already have. The Kenya EMR is a system that is supposed to capture information about the patient as the patient goes through the treatment process. Now, if I wanted to do costing, to just understand how much it costs us to treat that patient, I don't need to do another survey. What I do is to understand what this information is all about and try to see what additional information I need to capture so that they can capture it routinely. And therefore, I'm able to get the cost of offering service without doing another survey. Because what we were doing is to say, okay, to maybe spend 1 minute with a physician, it costs 10,000. To spend 1 minute with a nurse, it spends 5,000. To spend 1 minute with a clerk, it takes maybe 2,000. But this system has already told us that this person met a physician, he met a nurse, he met a physician. So we can just tailor it in such a way that it captures for us how much time they spend with each one of them. And at the end, we know the cost without us going to start observing how patients come. We already have a system. So I think I agree with you that data collection is expensive, is quite costly, but we can try to see the type of systems that we already have, what type of data can we get, and so that we only go in to collect data that we require to fill in the gap, and we do an assessment. Yeah, thank you. Yeah. So thank you very much. Let me not take a lot of your time. I think I'll be available for a few minutes in case anybody has a question. Otherwise, I really appreciate this opportunity of you listening to me. Thank you.
Thank you, Dr. Alex. And this is a nice segue to the next segment, which is on the panel discussion. And I'll invite Tabitha to lead that segment.
I think in terms of what we wanted to learn this week, do you feel like we have met the objectives of our week? And we had also shared what we would like to learn when we're filling the form and how we'd like to apply it. So probably before we do an evaluation, yesterday we didn't do the course evaluation, so we'll do 2 today. But before we do the course evaluation, I would like to hear from us if our expectations have been met and the applicability of this week's training to what we hoped to achieve or what we hoped we would learn to be able to apply, and if we'll be able to do that. And any pending questions or discussions. I had, there were a few questions on when after topic prioritization on what was the right answer. So finally, what was the conclusion? What was the answer? So if there are any pending questions in our minds, I think this is a session that we can probably go through them before we can do our next steps, and we'll be guided by the timekeeper. We have a photo session on 5th floor So you'll guide us if we could have the photo session just before lunch, if we could break for lunch and come back and finish, or in whichever format. So as you brainstorm, I can be picking feedback on the other questions that I've asked. Yeah, okay. So feel free to, and please look at me. I'm a very jealous person. When I'm talking to you, I want you to look at me. Eh? I'm always asking for you to look at me. Yes, it's nice to have a discussion when you're looking at each other, right? So I'm just hoping to hear from all of us. Feel free to give your feedback in whichever form. If there's a representation of how that feedback is given, happy to take that. If it's free for anyone to make a comment. I think when we were having tea, I was getting some comments and recommendations on probably designing modules that are accessible, or turning this course to a post-grad of sorts, and all those things. All those thought processes, that's what you're hoping to hear and take notes during this session. So, yeah.
Yeah, thank you so much. I think for me, the course was quite eye-opening towards what HTA is. I've always imagined what it could be, and it's quite good to see the material. The material was a lot. It has encouraged me to read more. Some concepts maybe skipped a little because of the time, but at least we'll have the material to go through. Maybe you could just share with us the material. That would be good. I think online there are some of the sessions are not active when you click on the link. So it would be good for us. And if you have any further material, it would be good. Thank you.
Noted. Anyone else? So for those who've come in, you're looking at me very confused. Just observe and go with the flow. Okay, we are having our plenary discussion, and we are picking out any pending discussions from the week's sessions, anything that were not clear, or any suggestions, that you may not have filled in the form that you think, or if you feel this week met your expectation and your objectives, and any applicability for what we've learned that you see that will happen. So we're just having a discussion of any pending issues.
I just wanted to tell you something.
Okay. Okay. So I hope it's audible. I'm audible. So ni fure ama nisikize? Is it on? Maybe I shout. Okay, so I hope I'm audible now. I appreciate the opportunity to have come for the course. I work at KNH, and every year, successive year, we keep on having our budget reduced, and the cost of the medicines keeps going up. So this is quite helpful trying to think through what can be included. And additionally, not just looking at how to take the costs down, but also look at what intervention that we may need to lobby for more funding, because the benefits are very clear. So I'm liking that. I can see how I can apply the cost.
Okay, thank you for the opportunity. Mine is again to thank you for extending the invitations to us and the very nature of the training of being a multidisciplinary approach. I am one person who was suggesting that we get these as modules that can be accessed in MOH Academy. At the same time, I'm also thinking we may want to institutionalize or mainstream some specific modules to the pre-service training institutions, being a very new concept. I was also asking whether we perhaps need some policies on HTA, an HTA policy, even as we think about introducing HTA as a main component within our healthy policies,